didn't appreciate natural versus where's the rainbow. So.
Oh, good. Miriam. Yes,
Hello.
we're waiting for you.
Oh, I'm sorry.
No, no, you don't apologize.
Yeah. That's what I was doing. That's why I'm late. No, I just finished. That's why I'm late.
Oh, okay. All right.
We will have a forum.
Indispensable.
Yes.
Okay, we are ready to go.
Okay, so good evening, everyone. Welcome to the January 11 meeting of the Health and Human Services Committee. My name is LV Barroso, and I'm the chair of the committee. Tonight, we are joined by Assistant District Manager Brendan Bird. This meeting is called to order at 6:36 p.m. As a reminder, the New York State law requires all community board members who are not able to attend the meeting in person to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. Members of the public who are attending virtually, you can raise any questions or comments that you have through the Q&A feature of Zoom. Members of the public who are here in person, you can raise any questions that you have by raising your hand. If there is time following the committee's discussion, we will field questions from the public. We need a volunteer to take minutes tonight. If you are able to take minutes, please let us know.
All right, we'll send the minutes template to whoever takes minutes.
Guess he will.
Yes.
Oh. Jerry? You're volunteering?
No.
I'll take the minutes, why not?
Raj, thank you so much. So we will now take attendance by roll call. Brendan?
Okay. Committee members, I will call your name. When your name is called, please say present. I will announce if there is quorum. Marty Barrett,
Present.
Elvie Barroso,
Present.
Rob Friedman,
Present.
Sandra Leftoff is not with us. Raj Nayar,
Present.
Kevin O'Keefe is also, let me just check.
Excuse.
Kevin O'Keefe is excused. Miriam Rowe
Present.
and Jerry Weinstein.
Present.
We have a quorum.
Good. The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, please raise your hand. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from the November 9th meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, please raise your hand. Seeing no objections, the minutes from the November 9th meeting are adopted. They will soon be available on the CB6 website. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members who are here in person, if you have a question about committee business or wish to make a motion, please raise your hand and I will identify you so you can speak. Committee members unable to attend in person, if you have a question about committee business, you may raise your hand through Zoom and I will identify you so you can speak. all committee members, it is extremely important that only one person speak at a time so that members of the public watching at home can understand what is being said by each committee member. The chat function for committee members present via Zoom should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. We have two agenda tonight. The first one is the presentation on contract negotiations between the city and the Committee of Interns and resident members at Bellevue Hospital. And we have Alyssa.
Yes,
Alyssa, you wanna just introduce yourself?
sure, yes. Good evening, everyone. My name is Alyssa Ruiz Nicholson. I am the Director of Community Relations and Engagement at CIR. Should I mention what CIR is? Okay. CIR, or the Committee of Interns and Residents, we're a national local of SEIU. So we are sister locals of the other purple unions like 1199, 32BJ, and Doctors Council. So CIR, we represent resident physicians and fellows across the country. We have about 30,000 members in over 11 states. We have over 7,000 members here in New York City. All of the resident physicians in New York City Health and Hospitals are part of CIR. And also some of the private safety net institutions are also part of CIR. Our latest in New York to join CIR was Montefiore up in the Bronx. So we now are representing all of the resident physicians that are training in the Bronx. So that's exciting. Yeah. And we're waiting for Dr. Melissa. Oh, she's here.
I
Yay.
snuck in. I apologize, I had an emergency at work. I'm Melissa Tabor, I'm one of the anesthesia residents.
Sorry to interrupt, but, in order to be heard better with
Oh,
our
yeah,
camera,
sorry.
if we could.
Yeah,
be
you need to
towards
sit.
the
And John, we have
You know, while Dr. Tabor's coming up, I'll speak loudly. I just wanted to say that, Ms. Nicholson, Dr. Tabor, and their colleagues who are here tonight, came to us through Michael Devereaux, who is a member of the, community board. My name is John Keller. I'm a member of the community board. And, they came to Sandy McKee, our board chair, and myself. And Sandy wishes very much she could be here tonight, but she's at Senator Gonzalez's meeting on the casinos, so they're splitting the duties. So I just want to welcome Ms. Nicholson and Dr. Tabor and their colleagues, and appreciate very much Dr. Barroso's patience in putting this on the agenda when I was quite proud. Much appreciated. Thank you.
Oh, did you want to introduce
Oh,
yourself?
yes, hi, I'm Melissa Tabor, I'm one of the resident anesthesiology doctors at Bellevue. I apologize, I was late because we had a little emergency at work. And I'm a PGY 3, which means I'm in my third year of residency. It's my second year of anesthesia training.
So should we begin with the presentation? Okay, so you can go to the next slide. So I think I mentioned this, but we are, oh, yes, there. 30,000 members across 11 states. We have 455 members at Bellevue. And like I mentioned, all of the residents in the New York City Health and Hospitals. We're the largest and oldest house staff training or house staff union in the country. So you can go to the next slide. And so as a union, you know, we lead by our values. I said before, there's other doctors at the table, so I didn't have to go into what, you know, residency is. But, you know, not everyone understands why residents are in a union. And I think a lot of the general public thinks doctors are, you know, in their careers but, you know, there is this point in becoming a doctor where you are in residency, where it is grueling, where the conditions are, you know, what they are. And, you know, and the fact that, it's not like other types of labor where if you residents are matched into their programs, which means they're contractually bound to these programs. And if you have a hard time with your employer, it's not like a resident can just up and leave and find another place to work. It really does a lot of damage to their credibility and to their, the possibility of them even pursuing the career of becoming a doctor if leaving, if you leave your residency. So there's a lot of it's just a time in a doctor's life, and I'm sure you can explain better than me that where there's definitely a need for their voices to be heard as the frontliners of care, and advocating for better working conditions, making sure that they are being paid fair wages for the work that they're doing and the life-saving care that they're providing. And also, advancing patient care, making sure that hospitals are safe for patients and safe for our residents. We also have a lot of programming that focuses on our residents' well-being, right? Understanding that residency is very difficult. And so we want to make sure that their mind, bodies, and souls are protected in this work. And so we do a lot of work around making sure that, around resident wellness. And we engage the communities we serve, and that's a lot of my role at the union, is identifying opportunities for our members to partner with community in a meaningful way that's mutually beneficial, both for their training as physicians, but also for the community. So we do a lot of work that's focused on health equity, addressing health disparities. We have a program where we bring doctors into schools. So those are the kinds of connections that we make. And obviously coming to the community board meeting, I know we have a specific thing that we want to talk about, but our long-term goal is to hopefully continue a conversation and a relationship with this community board, because we have members that are providing care in this community. So you can go to the next slide, and then I think Dr. Tabor is going to take it from here to talk about where we are in negotiations.
Excuse me. So our contract expired in August, I believe, of 2021. There were a bunch of kind of delays to us getting started having conversations regarding our contract. Part of it was related to just general delays with the city, with COVID, and other such related issues. We started our negotiations in August of 2023. We had one session in May, kind of just to, lay some groundwork, but our real negotiations, started in August. Currently, the offer that is being presented to us is a 3% raise per year, which, while that is, something that we've kind of seen in the past with the current inflation and how things have been changing around us, it would put us far behind, not just the rising cost of living, but also the other, the raises that we are seeing in comparable institutions, safety net hospitals, co-residents who are working in basically the same kind of place that we are, just not in our contract. We would be making on average about $5,000 less per year than our colleagues who are doing the same job in another hospital. And that not only affects us financially, but also makes recruitment very challenging. I truly believe that Bellevue is a wonderful hospital to work in. I am the kind of person that I had to stay late today and I was living the dream. This is what I want to do with my life. I love my job. I want people to see how wonderful our hospital is and our community is, but it's really hard to convince people to come when you are offering them less than what other, similar looking institutions on paper are going to offer. So we're fighting obviously for ourselves and for our contract, and in doing so also fighting for our patients. So the cost of living, like I said, has gone up dramatically. The cost of just getting your basic groceries has gone up. My husband and I are actually both 18H employees. My husband works at Jacoby, so he's part of the same union. And we are currently living in Forest Hills with my 2-year-old son still in our bedroom because that is what we can afford. while we work crazy hours. Which again, we're not complaining, we love our jobs, but it does add like a little bit of, stress to our daily life, and kind of how we manage that is challenging, like. We want to continue to be the best physicians that we are. We want to also continue to be able to recruit the best physicians to our communities, because we truly do believe in them. And, we want to be able to provide care to patients who oftentimes are not eligible to get care elsewhere, or are not, they don't have the access to care that we would hope that they would have. But like I said, we are falling behind, and we are not going to be able to be competitive come the next match cycle. Meaning, I don't know how familiar everybody is with how residency matches work, but I like to say it's kind of like when you went to that you basically rank the hospitals and how you view them, and then they also rank you, and then a computer system matches you together. And places that are not able to sell themselves, so to speak, are not going to be ranked high, and then they're not going to match candidates that they want, because those candidates are not going to rank their institutions highly. And then one other, kind of interesting piece of this has been the closure of the Beth Israel Hospital. We are expecting over at Bellevue to see a large population of patients come from those who would normally go to Beth Israel, because we are one of the closest hospitals in their proximity. We're already stretched thin. We work long hours, and we're like long hours on a contract from over 2 years ago. With this increase in population coming to our hospital, it only means that there's going to be an added work burden for us, which, while it will be manageable, it will definitely be more manageable and easier to offset if we can feel like when we go home that we have the resources that we need to take care of ourselves and our families. So, it's clearly urgent that the board here and Mayor Adams recognizes that there is a need for residents in New York City in general to be paid fairly and appropriately. So we're asking for your support, basically asking for a letter that would indicate that this board and community boards across New York City, like this board, support your doctors, your resident physicians in receiving competitive compensation, so we're able to continue to recruit and retain the best of the best, because our community deserves it. We're also, as a separate plug, we're also going to be holding a rally on January 30th at 12 o'clock, and we would really appreciate anyone who does have the time and ability to come and support us there.
You still work 60, 70 hours a week?
It depends on the week. I think my average is somewhere between 60 and 65. We're considered to be a lighter program. Send information as well. Yeah.
I just want to clarify, did you say the residents from the health and H&H are getting 5,000 less?
So if the proposal,
3%.
correct, if we take what they are currently offering us, what is on the table right now, we will be on average getting about $5,000 less per year than the resident and equivalent training at another safety net hospital.
Boy, man, I have yours.
Yeah, hey, thank you for coming. Question for you, are all the residencies at Bellevue just at Bellevue? When I did my fellowship at Bellevue, the residencies were combined at NYU
Yes.
and Bellevue, so we were getting part of our salary from NYU and part of our salary from Bellevue.
Interesting. So it's still a split experience. Like, we spend some of our time at NYU and some of our time at Bellevue, but we're either paid through NYU or paid through Bellevue. We are on completely separate payrolls. And so we're also falling drastically behind our NYU pay colleagues who are doing literally the same job as us. There is no difference in the schedule making based on which hospital you're paid through. I don't think most of the schedulers even know who's paid through which hospital.
So you're rotating back and forth through NYU and Bellevue. And some people are getting paid at NYU and getting paid higher.
Yes.
And some people are getting paid at Bellevue and getting paid
No,
lower.
Correct.
So, my next question for you, and, it was a great presentation. Just one thing I thought I didn't see was like the data of like, what does Mount Sinai make? What does NYU make? What does, Cornell make? What does,
We do. have-
Einstein, Jamaica?
Yeah, I have the figures.
It'd just be nice to see, cause like, if we saw like, oh, you guys are about like average, like in all the hospitals, say, okay, versus,
Right.
oh, man, you guys are like way behind. It'd be
So
nice to actually see the data of
Yeah.
where you are.
I think Lilith had had,
I'm gonna
Okay,
text
perfect.
him right
cause I don't have it on me offhand. We were, trying to the best of our ability to, kind of focus on other safety net hospitals that are, coming from the same financial background when we were looking at what we thought would be a fair contract. And even in that scenario, we're still being paid significantly less than, other residents. As far as like the comparison with NYU, I think that's on a separate spreadsheet. I'm pretty sure he has two separate ones that are kind of comparing us to NYU and to Cornell and to Sinai and then also to other safety net hospitals. So we can try to get that for you.
Yeah.
So a few
Okay.
questions.
You wanna question?
Yeah, hi, I'm Jerry. I don't think people realize how little you're paid. You need to indicate that because you're in New York City and people might think, oh, 3,000, they're making 90,000. You're not making 90,000.
You're
Tell
over
people,
$20 an hour. I mean, like, it's crazy.
tell the people the median of what you're making.
I think it works out to about $70,000 a year and we can work up to 80 hours a week, which works out to about $20 to $22 an hour.
So that escapes so many
It's
people.
crazy.
And that is with 4 years of undergrad, 4 years of medical school, and my third year now.
Sure, because people might even say, well,
student
surely you
loans.
can like
Yeah,
mow a
we're not-
lawn or
Yes.
do EC when you're working that many hours at that little,
Concern.
a $5,000-6,000 is obviously 8%
Yes.
of an increase. And when you're missing that, it is the difference, like, I mean, this is a separate matter, but I would imagine, I don't know whether or not the union across the 30,000 has a credit union. And if you can make, low-cost loans, first home, all that sort of stuff, which is beyond this conversation, but which tries to circumvent the high cost of living. And then even to just among your 30,000 members, the data that you have for all the markets with regards to San Francisco, other high value and even the example of a good contract that has been executed in another, city.
Right.
Well, historically, it has been like that. Isn't it, Vera? It has
Cycle.
been like that.
Break the cycle.
It's about time for them to voice out that.
I will say also, I think we're feeling it more now. The loan repayments did just restart. Thank you for remindering me. And at the same time, we're seeing high cost of living, and at the same time, we're seeing that the schools that we went to are so astronomically more expensive now than they were even 20 years ago. And so the payment that residents are making is in no way keeping up with, just even if you're looking just at the cost of medical school to the what you're making your residency, it's just like such a discrepancy now.
I think a sample budget where, again, somebody might be unaware that you're paying you yourself, I'm projecting here, $800 a month in student loans. And that people will not have a clue about what the P&L looks like. And that goes a long way into introducing sympathy, empathy.
I believe, so it's the income driven repayment plans, like which are our
Right.
best option currently. It's about 10% of your salary, so we're talking around it's a little bit less than 7,000 because they do some fanciness with the numbers and I don't have the numbers offhand. But now we're talking about the difference of $5,000 between us and another institution. It will make a huge difference.
NYU is pretty, so.
I'm aware, I did not go there.
Now.
You can't all get into NYU though.
No, I have to cure cancer again to NYU at
There
this
you
point.
go.
But, Cornell and Sinai have very good, I should say very good, but have subsidized housing. So, I'm at Sinai and our residents have subsidized housing. In Cornell, when I was at Cornell, they had very good subsidized housing. But NYU, when I was at NYU, that subsidized housing was terrible, honestly. And I was just wondering, is it still like that where like you don't really have subsidized housing, or do you have subsidized housing?
There is some, there's not a lot of space. And then there's also nothing larger than a 1 bedroom, which like for my family was just very challenging, because like I said, we have a child, we have to live in for childcare because of how many hours we need, so like we couldn't make that all work in a 1 bedroom. I do know people who do it, but there are very few people who actually want to be in the subsidized housing and then also were able to get into the subsidized housing. But you do get the money back if you apply, you don't get in.
Kips Bay was supposed to be the housing.
Yeah.
I don't know if they still do that, or they just turned everything into market rate and.
If the city is offering 3%, what is the ask from your side? And I'm assuming there's gonna be back pay too, since the contract ended in 2020.
Yes. I don't know what the percentage actually works out to. We're basically aiming to be at around where similar safety net hospitals are, but I don't know the number offhand.
Okay, I'm just wondering like how far the city is from like, you know, what you need. to have,
Yeah,
Like a decent life here.
well, I did get some numbers here. So I know, in 2025, so if they accept what the offer is on the table, a PGY one in health and hospitals will make 76,900. And a PGY one at St. John's in Far Rockaway will make 89,000. In New York Methodist, 84,000, Bronx Care, 83,000, MIMO, 83,000. So it really significantly puts them far behind. And those are comparable, hospitals to providing the kind of, the same kind of patient care for the same type of patient population. Let me ask a little bit what the,
The nurses are getting paid more than,
Oh, always.
yeah.
And they're great.
Right.
Not saying they don't deserve that. But yes, cool.
The funding for Bellevue comes from the city. And there's across the board cuts every single thing except NYPD where it was getting cut. So I guess this is within that background of across the board budget cuts, right?
In
No,
this,
they don't have to cut in salaries. It's the total, they look at the total HHC budget and they say, yeah, cut this. So, they figure, well, we're not gonna, open these beds now, or we won't, there's other things that they can do to rearrange for the cuts, not necessarily salaries.
I'm not sure they can get rid of beds. Is that true? Because I think
Years
the beds,
back,
there's always people sitting in the ER who can't get into a bed.
they've been closing hospitals because there was excess beds, so it's.
were you happy with the city's role or going forward? Do you see structuring it the same, or is it necessary for you to even reimagine what the negotiation process looks like?
Can you,
Well, I mean, it's been a long time and there's the COVID excuse, but we all know, and you know more than I, haven't been on community board, that the previous two mayors left all these unresolved union contracts, and here we are. Who it's the mayor's office, and are they acting in good faith as an arbiter between the two? I'm just wondering if, even if that is like effective, and if it differs from other cities.
that I honestly, I can't answer that. I'm not.
I can jump in for that one. Sorry.
That's who's I've been texting.
He's the voice.
Yes, he's the area the regional director for New
The
York Public, so
omnipresent.
he's, yeah.
Apologies all. I'm still in the middle of driving. I do apologize for not being there in person. But in reference to a couple of questions that have been asked, I mean, I think that the sort of city's position is that they have given sort of 3% across the board to all the other city unions, with the exception of the nurses. They gave an equity adjustment to the nurses because they recognized how far behind other safety net hospitals that H&H was falling, and how much money they were then having to spend on agency nurses. So the proposals that we've put at the table essentially are saying, look, to be at the median, not to be at the highest, but not to be at the lowest, we need to see by 2025 a first-year employee, PGY1, for those that are physicians in the room, at $82,000. That would be at the median, at the middle of safety net hospitals in New York City, and allow for health and hospitals to be able to not only recruit, because the other part about this is also retain. That's another issue that health and hospitals continues to have, is all of these residents match and attend, but say, look, if this is what the salary and I love the patient population is like, why do I want to stay? So for us, sorry, go ahead.
No, I was just gonna clarify that I don't know if you're seeing this, but we're seeing on the screen right now is the 2022, which is like what we're being paid now, and how we compare at the beginning of these negotiations, but the other tab is the 2025, given everybody else's adjusted salaries they will have, and you see how we were on like the higher end of the average, and now we are at the absolute lowest.
Okay.
Yeah, so just, I think there was some confusion in the room. Thank you, sorry.
Oh, all good. Sorry, I apologize. I did not see the screen. So yeah, and I want to be transparent with all that this same spreadsheet we have shown to the city, saying, look, if we accept the 3% that you're giving everyone else, this again will put these physicians and make them the lowest paid by 2025, which again is only a year and some change away. And essentially they're not necessarily willing to budge. And so, while we are at the table and trying to move them at the table, we know that it takes people pressure sometimes to move the city to do the right thing. And so that again is part of the reason why we are here with you all, as we're also engaging with other community boards across New York, where we have hospitals, to show that, the community wants and needs our physicians. For those that are attendings in the room, that it's residents that are seeing patients at 2:00 in the morning, right? When people come into the hospitals for care, it's our members that they're seeing. And so we want to ensure that they're able to take care of themselves to be able to take care of patients.
So a question for any of you, can you actually track, and I don't know whether because of COVID, your matching and recruitment is off schedule, but for example, let's just say this coming matching, can you actually then have the data from a fall off and presumably the lack of less competitiveness, ability to retain, and how that affects excellence?
I don't know if we're seeing it quite yet, because I think that the prospect of we were going to negotiations, and this will probably not be what the salary is when you get here, kind of affected the last match cycle, and we're not gonna have this match cycles data until match in March. We don't have that right now.
First, I think this data is super helpful. For me, it really puts things into perspective that last. Personally, I don't think you'll have a follow-up at all, because NYU and Bellevue is so prestigious that I think people will still want to come, because that's just the nature of who we are. But I think this is making a very strong point for me that you need it.
There are.
And I would also, and if I could just jump in real quick, while we are talking specifically about NYU Bellevue, this contract is for 8 H&H hospitals. So collectively, the union's concern would be that a really bright and talented physician that wants to work in our community says, you know what, I'm going to rank Bronx Care higher than Lincoln Hospital because it's the same patient population and it's 30 blocks away. So I think that's also part of another piece is it's not, again, and I know we are in the community board for which there is Bellevue and NYU, but it is also a piece of across the board, the sort of drain or the fallout from residents that want to work in our communities saying, you know what, if there's this $5,000 difference, that's substantial. It's not 1,000, it's not 2,000, you know, I'll rank Bronx Care higher. I'll rank Brookdale higher, which then deprives an already inundated healthcare system being H&H from, you know, physicians that want to be there, that want to do the work.
You know, certainly I think that because Bellevue and NYU are part of the same program.
Yes.
And because of that, there should be no pay gap, right? So I think certainly the argument should be like, whatever the pay is for people who are at NYU, show the comparison with Bellevue. And again, to the point of residency programs, you're not going to be able to get the quote unquote best and brightest if you're placing them in a financial situation where they have to look at Bellevue, who has a wonderful program, and say, well, I'm not going to get paid like someone at NYU. Therefore, I mean,
that is a very logical argument, and Dr. Tabor can co-sign that we have actually tried that argument. We have gone to NYU and showed this data, showed this information, and say, look, NYU, you have residents that are working side by side. You are not a struggling institution. Let's make some equity. And NYU has refused and continued to say, no, it's not their concern. Y'all deal with that during contract negotiations. Dr. Tabor, please forgive me because I know you were a part of that fight.
Thank you. That was a great summary. Yeah, it's very challenging. And because we don't have any, every program kind of does it a little bit differently, but most programs don't give you the opportunity to choose which payroll you're going to be on, at least when you first enter. And so you're basically telling your new recruits, like, I mean, Russian roulette, if you get paid this amount or this amount, like, don't know. And we've been able to, like I said, they were able to sweep things under the rug because we were in the midst of contract negotiations. It'll probably get better. It'll all even out. When I started, the salaries were basically comparable. You know, a couple dollars were here versus there. So it didn't make any difference to me which payroll I was on. Now there is a significant difference.
just full disclosure on my part, I have a family member who works at NYU. She's a physician there. So, and she's at Bellevue actually. So I understand a lot of what's going on because I speak to her quite often about these challenges. And therefore, I totally support your position and do hope something positive comes out of this.
Thank you.
I still don't understand if, you know, when I was at NYU Bellevue, we got paid 6 months from Bellevue and 6 months from NYU. That's not true anymore. You're just getting paid the whole 4 years or 3 years for Bellevue and the whole 3 or 4 years from NYU.
So certain programs will allow you to switch payrolls or preference of payroll after your first year. It's very like independent of like each department does their own thing with their residents. They can decide. They just have to put a certain number of residents on each payroll based on how many spots H&H is covering through Bellevue versus how many spots NYU is covering actually. So that's like my understanding anyway. But it's very different department to department. So some departments are seeing people who are like, okay, I'm fleeing this payroll at the end of this year. But regardless, as PGY ones, nobody ever has a choice from what I've heard talking to people in other departments.
How often are these contracts good for 5 years or?
3 years. I mean, it depends, but I think the city contract is 3, right, Lilith? It's
Yes,
3
that's correct. Yep, we negotiate for 3-year contracts.
So you're gonna have to negotiate again like next year?
No, interesting. No, our contract would probably run until that's a good point. Would probably run until 2026. So it would be because we were delayed, there would be raises for 2021, 2022, and then this sort of entity would cover 2023 to 2025, and then we would renegotiate in 2026.
So aside from making us aware about this, what do you expect from us?
So that letter of support that we were talking about, like having something that's coming from the community board, to, New York City and H&H, it just kind of says that you're supporting. We're supporting our plight and our fight for a better contract that, you know, is going to fairly compensate us for the work that we're doing.
We should put in a resolution.
Are you also presenting to the city council?
We, I don't think, well, we're looking to do a hearing with the city council. We are also, as Lilith mentioned, we're meeting with other community boards and making the same asks, right, of a letter of support or a resolution. And we're having the unity breaks at all of the hospitals, at all of the 8 hospitals over a course of 2 weeks, as another way to sort of put some more public pressure. And we do have relationships with city council members that we'll be reaching out to as well for some support. And I know our political coordinator is trying to work on scheduling a hearing where a lot of our members could come and talk to the council.
Do you have a time frame in mind? Apart from now.
I mean,
That'll be great.
that would be great. But I think unfortunately, we kind of see this drawing out a little bit. Like I mentioned, we have the unity break for Bellevue on the 30th at the end of the month. It would be great if we had something before then. I'm sorry, in terms of like the negotiations being done before then, but I'm not sure. We're talking about the city, so I'm not sure. So sooner than later, but I think maybe by the end of the month or early next month would be.
If we did the resolution, it would first be through the committee and then have to pass the full board. The full board meets the second Wednesday. So
Okay,
that was yesterday. So it'd
okay,
be-
okay, so it'd be February.
Have a feeling we're still gonna be
No, it's
negotiating.
gonna be
Yeah.
presented by March.
Yeah,
Oh, it would,
because we meet right after the full board meeting.
okay,
Yeah.
it would be March.
I think in February, you meet the week before the full board. on the
Oh,
8th.
do we?
Yes, February
Because
8th.
it's on Valentine's Day.
No,
I
we're
forgot.
meeting February 8th because of,
Brendan has.
yeah.
Actually, it's, full board will likely be on February 7th because that's the day that seems to work for the most members, not a Valentine's Day full board.
Okay.
So it would still be likely the day after full board,
Which is February 8th.
which is February 8th.
So anybody is volunteering to write a resolution?
Well,
To take the lead.
I'll run.
Martin?
I'm happy to give you any editorial. And I'm curious, as far as a resolution, what are the kind of must-have that we support the in good faith negotiation? And should we actually affix that the 3% is insufficient? Or go with?
Some of the stats that were in the slide will really answer the questions.
And I agree with your point about the equity seems like the simplest thing, that there shouldn't be, depending on which side your face is,
Yeah, and we're happy to answer any questions that come up. If you need more data, we can definitely share that. Thank you so
All right,
much.
so thank you so much for coming.
Yes, of course.
Thank you.
So can I just ask, so now, what's the process, going forward? Just so I am aware of what,
We'll have a resolution for the next meeting,
which is the eighth.
and so this committee would meet.
Okay,
And vote on that, and then it would go to the full board for the following meeting that they have.
In March.
So that
So
would be
that would be
March.
in March. Okay,
Considering you've been going through this for 3 years, the likelihood of it being resolved in the next 8 weeks is, it's possible.
yeah,
I hope.
yes,
And you should, if you are meeting with the members of the city council, tell them that you appeared and that we will write a resolution on your behalf
yes,
that is related. It's kind of,
yeah, definitely. Thank you.
Brendan.
Just one thing,
Yeah.
and if things do happen to be resolved by like either February's
Right.
health meeting or March's full board meeting, do let us know.
Yes, of
Because
course.
So the often if that happened.
Yeah.
So we don't have to.
it'll be a
yeah.
proclamation.
It would be a bit odd, it would be a bit odd for the community board to pass a resolution.
When it's already
Contract
approved.
negotiation that has already concluded.
Yeah.
Understandable, yes. Definitely will keep you
One other
posted.
point, since you are reaching out to other community boards,
Mhm.
certainly, since you know, to Jerry's point, since you know that ours is going to draft a resolution, when you do go to those, you can mention ours.
Yeah.
Maybe that'll drum up their support, because then they'll say, okay, other community boards are supporting this, it can get further traction.
Yes, thank you. We'll definitely do that.
We're your first community board.
No, we've actually, we've met with, let me see, Community Board 11, 10 and 11 in Harlem.
Okay.
And 9 in Brooklyn. And we're meeting next week with 11 in the Bronx for Jacoby.
Okay.
So, yeah.
So far support.
So far, yeah, between, 10 and 11 have definitely been supportive. Yeah, so,
And I'm curious within SEIU, have the nurses also indicated support? I'm wondering among your colleagues, because this is like a fiefdom hierarchy, whatever, but can you cut through that and actually?
yeah, I mean, I'm sure they have our, that they're supporting our residents, and we'll probably try to get some of them out there with us on the unity breaks.
Yeah, Adam, I would say that the nurses at the public hospitals are represented by NISNA, and they have gone through a similar fight. So they are definitely standing with us, and will stand with us as we go through this fight because they understand about parity and falling behind their safety net private sector colleagues.
All right, so thank you so much. for
Thank
coming.
you for having us. I really appreciate it.
Makes me
Alright,
tired
so
thinking
we're gonna
about what
move-
I've been doing.
We're gonna move now to the second agenda, because we are almost. How many more minutes left?
8.
So,
As long as the chair wants. You are the boss, you are the judge in this.
I don't
It's
mind
your-
staying.
It's your courtroom.
all right, so, did everyone have a chance to look at the rest of that was?
I'm gonna scroll down to the changes.
Is it
Yeah,
okay
the
if I highlight
changes.
the changes?
Was Keith still the lead or who was on?
Yeah, it was Lincoln Wrestler was the one who introduced the bill, but we just made a slight change of the ordering of the resolution, but not in any substance. It just basically a whereas was explaining what the bill is. And since it, I guess it didn't make it in 2023, we would like them to bring it, this bill or a similar such bill in 2024.
For that section that's highlighted, the long paragraph, I was wondering if it could be broken into like bullets, just so it's faster and easier to read. It made me think of a resolution we passed last night that also was broken down into bullets. To require the DEP to colon, and then break it down.
That's not what I meant to do.
Just a formatting thing. It looks really good. You did a nice job.
Reform.
Yep, I'm getting there. I'll likely uppercase
Yeah.
these, but I can deal with that later. So I'll scroll slowly now that we've bulleted. People can let me know when they want me to scroll down.
Oh, you can take out the two. You can just say post on
Where's
The
that?
second bullet.
the second bullet.
Where
you
your
are,
cursor
just-
is, eliminate the two.
Right,
Yeah.
yeah.
And people are always free to ask me to scroll up as needed.
Good. Any other comments?
So Wrestler hasn't, he needs to reintroduce this?
New session.
Yeah, it's a new session, so I'm.
Oh, that's right.
Yeah.
Okay.
So do we have to vote, Brenda?
If someone makes, if someone makes a motion to pass this resolution and it's seconded, yes. But we need a motion.
Absolutely.
Alright,
I haven't
so,
learned Mr. Robert's rules like fully.
Move
Well, we
to, move to vote on the resolution.
Seconded.
Okay.
so do you have to take the names?
Then you have to
Yep.
vote.
Yep, now we have to vote.
All in favor, that kind of thing. It's up to you. If you don't wanna call it, then we don't.
Yeah, so when I call your name, please say whether you are in favor, oppose, abstain, or abstain for cause. Marty Barrett,
In favor.
Bellevue Barroso,
In favor.
Brock Friedman,
In favor.
Raj Nayara,
In favor?
Miriam Rowe,
In favor.
Jerry Weinstein.
In favor.
With all six committee members in favor, this resolution passes.
Good.
Congratulations, Barack.
Breathe easy.
Your first resolution.
We're gonna get good air quality.
Alright, so, anything else?
Excellent.
Alright, so I don't have that much, except I want to make sure that everyone understand that we are collecting questions for the MSBI for February 8th. So we wanted to get those questions by January 25th.
Do you want to create a Google Doc that we can add to read as it's being created?
Yeah. Yeah,
Then we
and I
can-
think,
The
Stop
office should
redundancy.
have all those questions because
Yeah.
it has to be pulled together with CB2.
Where will it be held?
They are
we're-
still looking.
Jesus and the district manager of community board 2 are working on that.
Okay.
They've been tasked with, finding a space for the meeting.
So certainly, I would think it would draw a lot of people.
Yeah, that's one of the things that both Jesus and the district manager of CB2 are very mindful of.
Yeah.
As they're trying to find a space for this meeting.
Okay, so moving on to any new business?
May I ask a question?
Sure.
We talked about mental health at the last meeting.
Those are,
And I don't have a well-formed idea, but I just wanted to put it out to you smart people. If there's anything we could contribute, they're gonna go to like 1,200 beds, they're only 400, 1,200. Is there something that we could offer regarding like one of the #1 quality of life complaints I hear about the city? So I don't know if anybody has any thoughts about it.
Well,
That's
there's been a series of state programs called New York, New York. It was New York, New York 1, New York 2, and, they would fund lots of beds, but the eligibility to get those beds was kind of stringent.
Hmm.
In other words, if somebody had been, inpatient, they couldn't get a bed.
Hmm.
You can't go from inpatient into one of these beds. You have to go inpatient to your home or residence or something before you'd be eligible to get the bed. And so historically, there were lots of beds. My wife worked for 40 years for OMH, and she was very much involved in a lot of this stuff. It's really problematic. So I was going to ask her yesterday when they were talking about the beds that are being allocated, you know, what is the eligibility for it? Because that had been a major problem. Because somebody said, can we stretch the number of beds? And I was saying to myself, you know, who you allow to get those beds will determine whether or not there's enough. Because historically, there's been way too much. Because the way they would structure it. Problem.
It may be too early, but we also have this like launch of a teen mental health line. I forget if it was launched in October or something like that, and I'm curious about if they're tracking that and if that is responding to the needs of youth regarding mental health.
Yes, sorry. Oh, I was just thinking about emotionally disturbed individuals on the street and what is the city's responsibility?
You're not allowed to touch them.
No.
You know, well, okay, when my wife was working inpatient, you know, we'd be walking along the street and there'd be this person yelling or screaming or whatever. And I teasingly would say, is that one of yours? And sometimes it was. You know, after they're released and whatever, and she said, the greatest thing happened when cell phones came out, because then the folks who would be walking along the street, talking loudly, whatever, yeah, you think they're on the phone. By city law, you can't just say, we're putting you in someplace unless they're specifically doing something that's dangerous.
unless they are harmful to
Yeah,
unless you see them that they are harmful or they are causing unsafe to that particular area, you can call 911.
and
And-
under a certain temperature though. Also, there's an issue that you. put something-
Because I remember the mayor in the past year proposed NYPD taking people who might be having like a mental situation on the streets, like forcibly taking them to a hospital. And it was very controversial. I don't know if he stopped it, but this happened in the past year. And I don't know if it's still happening anymore.
I'm ignorant about this. Is there any intake ever at the various shelters? As far as like, to just observe clients that are coming in and to coordinate with other city agencies if somebody actually needs that level of help, apart from just needing a bed to stay in.
At the 30th Street intake, so they do an assessment.
Yeah.
And part of that assessment is they do check that mental acuity and such. From what I recall that they would do, and I'm assuming they still do it. In the event they have a client who comes in who has some mental illness, they have specific shelters that are associated that have like almost like an assisted living. They have, social workers, others and such at these places so that they can actually move that individual. And the only problem is that because, when it comes to shelters and homelessness and such, it's all on a voluntary basis. So if an individual stays on the street and, to Marty's point, if they're having an episode and they are acting out violently, then, and fortunately only then you can actually contact 911 and get them involved. Because if there's just someone who's just talking to themselves, who just seems to be, erratic in their behavior, but they're not doing anything that's gonna potentially harm someone, you can't do anything. You just have to let them be there. And to Miriam's point, yeah, the mayor wants to pull those individuals off and put them in hospitals, but the problem is that that goes against civil liberties. So it's
Yeah.
like.
It's gonna be more.
Yeah,
Yeah.
and it's still happening. I just found an article from January 3rd of last year, for that is 2024, sorry.
The 30th Street Shelter used to have several different programs run by different organizations. I think Goodwill had a 20-bed or a 40-bed psychiatrically there. There was, we used to go there. We would tour the facility.
Yeah, they have a small
From
family
citizens.
intake as well,
Mhm.
but it's predominantly single male individuals
Yeah.
that are intake over there. And, part of their assessment is mental, they also look at criminal. So according to what they've told us in the past is that if anyone has some sort of criminal background, they have certain shelters that they can, direct those individuals. That came mostly because a lot of the individuals in our community were concerned about people being placed who might have had, convictions for sexual, type crimes and such like that. So they've given us that assurance. Again, we're kind of at the mercy of their leadership to tell us what they are doing and such. But unfortunately, when it comes to with mental illness, our hands are tied.
The only thing I would say I can look into is that I have a number of friends that have started organizations over the last like 8 years, Street Lives, Humans.NYC, and I can ask them about what their best practices and interventions are for their clients in their community. And to see whether or not it's a resource question that if they had X amount of money, they could scale a good idea. So I can look into that.
Yeah, that's a great idea. And it may be nice to have a talk to us,
Oh, absolutely.
so that we could learn.
Have a forum.
Yeah.
Yeah, that's good.
Yeah, each does different things. My friend Adam started Street Lives to create program services for the community and hand it over to folks who are homeless. And Josh his whole thing is to get people into direct housing and circumvent this shelter structure. So.
Okay, and I also want to bring up, remember we plan to do small health fairs? Does everyone else would like to pursue that idea?
Now, if we can't find a space.
What I-
We did this a
Because,
couple
I was
years.
just thinking that we have a big event in March, the World TB Day. That, you know, if you wanna do something, we can provide, TB testing or chest X-ray.
Oh, so have like a mini event, not
Yeah,
the,
yeah,
not
we're
the 40,
talking,
not the
no.
40 tables that
Yeah,
we were looking.
remember we were talking about just small events that we can participate when there are big events happening.
Oh, okay, yeah.
So,
Isn't that, Jerry?
Yeah, well, one thing I didn't finish for tonight is that I looked for several resources and I found another one today where I did create, it's 80%, 90% done, an editorial calendar of all the sorts of things that you experience in a year, and there are literally dozens to choose from. It's like Lupus Week coming up. And so that I will share, I will send around when it's finished. And I think I didn't know to what end. One perspective is I thought, well, we could easily take little bites and make sure that particular events that we agreed on ahead of time, or even 6 months ahead of time, were in the newsletter or in blast and so forth, and that we could go to where people had set things up, rather than chase, things, see where there are, things. So I will
Okay,
share that with you.
all right. Any other business? Any other old business?
For March, is there a place that participates in the World TB Day? Where we can partner with them and promote it in the newsletter?
Well, we have an upcoming conference on World TB Day, the Department of Health.
Oh, wow,
Which
okay.
is in March. But it's a conference,
You're not doing anything for the public?
it's for MDs and nurses. March 22.
Would they be open to doing something for the public?
Before I forget, I had a question I should have asked them, but perhaps somebody knows. Am I to infer that the rate of pay for safety hospitals is lower?
yes.
They didn't show that data because they only showed safety hospitals.
But the safety
But
hospitals
we didn't
compared
see,
to.
we didn't see the data.
It's sort of, it seems to me like the analog to why we have no general practitioners, everybody is the more highly paid specialist. But we need public hospitals and safety hospitals.
To the point, with the pay gap between NYU and Bellevue, the example, again, same program, same doctors.
Different
discrepancy.
classification.
Exactly, and therefore that's been, and that's why, to the director's point, that he tried to make that, argument with NYU, and they just said nothing to it.
Right.
So I mean, I think we can use that as almost our example of what's going on in other comparable, because I feel that it is certainly a health and hospital issue.
Tactically, should we overshoot their runway a little bit? And raise things like that, the equity thing?
No,
Okay.
Like,
just do what they ask.
you can have the
You know.
data of the private,
Mm.
of Cornell, Mount Sinai, NYU, and show it, because I don't know for a fact that that's true. It could be very well true, and you're probably right, but let's see the data, and if it is, it's all the more reason that she's right.
My niece is in her first year out of nursing school, working in Hartford Hospital ER. She's making more than mine.
100 plus.
But they're residents, so
They're
they're in
residents.
training, it's
And
not
I-
the same thing.
And, she's out of, 1 year out of nursing school. They're 3 years.
Out of nursing school.
Yeah,
That's the,
they're 3 years
Yeah.
or more out of medical school.
It's different
It's not the
because
same.
it's like they're in training.
Yeah.
Their salaries are gonna go like this
Yeah,
in a couple of years.
in a couple of years, it's gonna go up,
Yeah.
so.
My nephew's an ENT in Atlanta. His father is an ophthalmologist. He knows he'll never make the kind of money that his father has made. Ever. And he's a cancer trauma specialist. he's done these 19-hour operations, you know, working for the Cancer Center of America, or whatever that, you know, the hospital is, they have one in Philadelphia. And
I think they need the nurses.
nowhere near what
That's
his
my big
father.
takeaway. Whoever
A
got
lot
the
of it
mean,
has to do with,
contract is.
There's a lot of variables,
They
you know,
do.
there's some
Insurance.
surgeons that are making $6 million a year.
Mhm.
And there's some pediatricians that are making $80,000 a year, so there's
Yeah.
all kinds of variables. Plastic surgeons making well over 6 million.
Yeah.
So just because somebody's a resident making 70,000 and then in 2 years they're plastic surgery making 6 million. I mean, it's not the same as a nurse coming like right
Okay.
after, you know what I mean?
Okay,
But still, I think having that data, what does Cornell make? What does Sinai make? What does NYU make? All these safety net hospitals, and if they're, I mean, they're dead last, so they definitely deserve something, right?
Okay, so no other business?
I'll do some research before, well, in the writing of it. And certainly having their screens.
Yeah. All right, so seeing no further business, meeting is adjourned at 7:45. Thank you, everyone.
Thank
for
you.
coming.